Hello and welcome to our webinar, Community-Based Model Approaches to Engage Diverse Communities. This panel is being presented by Wilmot Cancer Institute, Office of Community Outreach and Engagement, in collaboration with the Community Cancer Action Council, or CCAC. This group is charged with bringing information on cancer and cutting-edge care to both the community and healthcare providers with a focus on health disparities. Throughout the presentation, please feel free to enter any question in the Q&A box located at the bottom of your screen. Today, we will be hearing from our panelists on their approaches to implementing community-based models in bringing cancer care to the community. Joining us, I have the pleasure of introducing Jeanette Berkley Patton. Is a professor at the University of Missouri's Kansas City, UMKC School of Medicine, Biomedical and Health Informatics Department, the director of the UMKC Community Health Research Group, and the director of the UMKC Health Equity Institute. Her expertise is in using tailored community engaged approaches to develop, implement, and evaluate health screening and linkage to care interventions focused on HIV, STIs, HCV, mental health, dementia, diabetes, and COVID-19 with African American populations in collaboration with faith, community, and health agency partners with funding from the National Institutes of Health and local and national foundations. Her research also focuses on mental health and resilience with urban youth in community settings. I also have the honor of presenting Alejandra Hurtado de Mendoza. Alejandra is an assistant professor at the Cancer Prevention and Control Program at Georgetown University Lombardi Comprehensive Cancer Center. She is a bilingual social psychologist with an interdisciplinary training in anthropology and communication, culture, and technology. She aims to combine interdisciplinary approaches in social psychology, behavioral science, and communication to develop and evaluate interventions that address stark disparities in the uptake of genetic risk assessment in high-risk underserved groups. Her research focuses on translational genomics with underserved populations. And lastly, but not least, I have the pleasure of introducing Ash Alpert. Ash is a fellow in hematology and medical oncology at the Wilmot Cancer Institute of the University of Rochester Medical Center. Dr. Alpert's research investigates community solutions to improving the experience and outcomes of transgender people with cancer. They work with an advisory board of transgender people who have been diagnosed with cancer and with whom they have conducted research, published manuscripts, and successfully applied for grant funding over the past 2 years. This year, with a joint investigator award from the Conquer Cancer, the ASCO Foundation, Dr. Alpert is developing patient-centered and non-stigmatizing gender identity data collection methods that can be implemented in oncology settings and investigating the connections between violence and cancer rates for transgender people. I will introduce you to Norma Holland, our moderator for this event. And Norma Holland is the Director of Public Relations in the Office of Equity and Inclusion, part of the University of Rochester. So welcome, everybody.
Thank you so much, Francisco. I appreciate that introduction. And I just want to give a warm welcome to all of our panelists who are with us today, who took time out from their schedules to be here and to share with us their expertise and their knowledge. So thank you very much in advance. I also want to say a big thank you to all of you who are in attendance today for this event and for this conversation that we're going to be having today. To all of the panelists, you know, we only have about an hour, so we want to make sure that we fit in as much as we can and have the most rich and robust conversation that we can have. So before we begin, I'd love for each one of you to give me an elevator speech, if you will, about the work that you're doing right now and what your model for community engagement in academia is. And if you can even throw in your biggest success, if I could give each one of you about 3 minutes. So why don't we start with you, Dr. Berkley Patton. I think you're on mute.
There we go.
Yeah.
Can you hear me?
Yeah.
So we got a little bit of feedback. There we go. All right. Well, 3 minutes and our biggest success. Well, let me just say this, that the work that my research team and the Health Equity Institute does basically started in the faith-based, the African-American faith-based community. And one of the things that we agreed on early was that we were going to meet the community where they are. We were going to focus the work on what they said was important, on the health priorities that they felt were really the biggest burdens that they saw on a daily basis, and that we were going to use a fully community engaged approach to address the work. So I don't know if some of you have heard of community-based participatory research before, but we have totally drank the Kool-Aid in using this research approach and have principled ourselves in making sure that our community is engaged in every single phase of our research, from conceptualization to developing our interventions, including the intervention components and materials and procedures, to serving as interventionists, to data collection, to helping us to interpret the findings, and then also some of our biggest disseminators and persons maintaining the work that we've been doing across the years. Our biggest success probably is most recently in some of our work focused on COVID-19 vaccinations. And we were funded 3 months ago by our Jackson County with $5 million and charged to spend it in 6 months to increase vaccinations across Kansas City's most socially vulnerable communities. In a very short amount of time, we've built an infrastructure that has brought on 60 organizations from the faith-based, business, youth organizations, and neighborhood association sectors, and have trained community health liaisons in all of those organizations to promote and organize and host community-based vaccination events with their constituents, with their neighbors, with their church members, with their youth peers, and with their customers. And we are significantly increasing the rates of vaccinations and using that approach. So I'll stop there. I think I'm at my 3-minute point. Gonna try to stick to your timelines.
We appreciate that. Thank you so very much for that. And I'll continue with Dr. Albert. Can you share with us the same?
Laura, thanks so much for having me. So my work centers around improving the experiences and outcomes of transgender people with cancer. And in preparation for this conversation today, I met with community advisory board I work with last night, and we were talking about, what we'd like to say about community research. And it was just like really beautiful to spend time with them and hear their thoughts about how we've built trust together. And I'd say those relationships are probably our biggest success. But more formally in the outside world, we've been working with the National Comprehensive Cancer Network and the American Society of Clinical Oncology to revise their guidelines so that they're gender inclusive. And given the ways that we in the cancer world often talk about bodies in a gendered way, it's really exciting to think about that language shifting to really include transgender people. So we're all really excited about that.
That's great, Doctor. Thank you so very much. And next I wanted to invite our third panelist, Dr. Hurtado de Mendoza, to also answer that same question. And so am I. I'm on mute, and so are you.
Oh, okay. Thank you. So I have worked with community-based organizations and community clinics, and I think the success is to build those relationships based on trust and mutual learning and these horizontal relationships. And I think the biggest success was that I think like 6 or 7 years ago, we both started working on the field of hereditary breast and ovarian cancer, and that was new for me, and it was new for the community-based organization that I was working with. And we literally learned together, worked together, started with a small pilot project, then it grew up, and now we have 3 different projects. We have developed 3 different interventions to increase the use of genetic counseling and testing in at-risk Latina women and African-American women. And together, we have been able also to incorporate screening for hereditary cancer in that organization, as well as in other community clinics and community settings, so that that system can be sustained.
You mentioned the word trust, and that actually leads right into my first question, because anytime I think of the word community or engagement, I always think of that one-on-one conversation, right? Because that's really what this all boils down to, is talking to people about their experiences and how they feel about something. But in order to do that, you have to build trust. That's what the central tenet of any relationship is, right? If I trust you, I'm going to tell you things that I might not otherwise share with you. And as doctors, as researchers, that's so key to your work. How do you go about getting and building that trust when it comes to community or even academic partnerships? What methods did you find useful or successful in helping to build a strong relationship with the groups that you want to, with whom you want to build a relationship? So let's begin, and we'll go in the same order. So Dr. Berkley, Patton, if we could start with you. And unmute, please, sorry.
Well, just as you said, of course, trust is built by building relationships and demonstrating that you're going to follow through with what you said you would do. And so for us, we've done that by, and I was sharing this with some others here earlier, we've done that by first always listening, and then always making sure that we respond and respond collaboratively. So, and this is probably going to sound a little bit crude, but we pretty much say we won't go out and ask people to give us information or to give us input if we're not ready to take action on what they say. Because people are tired of everybody pulling them together and picking their brains about stuff, and then they go away and they never hear anything more about what's resulted from that. And so that's one of the ways that we've been able to build trust, is by ensuring that when we listen, that there's a response and there's some type of action taken, and that people can actually see what they provided as far as their input and their comments and their work in the resulting work. They can see what they've helped create it. They can see their language. They can see what they said has been important in the work. And so that's been really key for us in building trust over a decade and a half of doing this work in the community.
Okay, thank you so very much. Dr. Albert?
Yeah, and I guess I just want to say it's really an honor to be here with the other panelists and hear about their work. So in my mind, trust is something that is built over many small moments over time. And I think the things that have been useful in my relationships with community members are transparency, flexibility, showing up as my real authentic self. And I think there's probably something to like me being like an insider and outsider, because I also identify as transgender and non-binary. And then working with community members as colleagues, making sure that our decisions are made by consensus. And when I was talking to community members last night about, how they think about trust in our relationships, they also mentioned listening, which was mentioned earlier, and then the ability to say no to any project. They talked about how sometimes with community engaged research, people will come up with an idea and then bring it to community members for their stamp of approval. And that what's really important to them is the ability to say no to projects they don't feel comfortable with, or to change, to pivot if things aren't working the way they think they should be, so that we can continue to be in integrity with each other.
That's pretty powerful to be able to say no to something, isn't it? When you don't feel that you want to be a part of something, or just to have the power to say no, right? I want to, before I get to our next panelist, I wanted to ask you, Lori is asking, can you mention more about what you mentioned earlier discussing with your advisory board? How has that developed over time, or how has that been developed over time?
So two of them, I'm not sure I'm gonna try to answer your question, but if I miss the mark, just let me know. So two of the community advisory board members that I work with, we've known each other for about 3.5 years. And I think that over the course of our relationships, we've worked on paper manuscripts together, research projects together, developed questions together. And so I think that in those conversations, being able to really try to deeply listen to each other has been really important and useful. Try to really understand what the other person's saying. And then there have been times when we've had some really difficult conflicts, especially around manuscripts, especially when it feels like there's a short timeline. And sometimes it's gotten heated and we've decided to take breaks and come back together later and just sort of think about it if we can't come to consensus. So I think that's also been helpful. But I guess what I was trying to say is, knowing someone over that kind of a timeline, you get to see how they respond to lots of different situations and get to see them show up over and over again. And I think that can be really helpful.
Thank you so very much. And I wanted to get to Dr. Hurtado de Mendoza to ask you the same question about trust building and, how do you go about doing it in the community or even in academic circles, and how do you build trust with one another? Oh, and if you could just unmute, sorry.
Thank you. I would echo what has been said so far about the importance of transparency, open communication, and making sure that everybody's in the table when making all the decisions. And I think reciprocity is also key, and being there for when the organizations need you, being flexible, being open. And I think it develops with time and showing day by day that you are there, that this is a reciprocal relationship. And I think at the end of the day, you develop personal relationships too, because we are all working, we're all passionate about reducing disparities, and at the end, you develop a personal relationship that is built on trust.
You talked about, and earlier on, I asked you all to talk about your successes and to share with me and the audience once, some of your successes. But people naturally, as human beings, we love to see things happen right away, right? If you initiate a program, I want to see what things look like in 6 months, right? And that's just a natural part of us as being human beings, but success takes time, and being realistic about that time. How did you, or can you tell us realistically how long it took you to actually see success, right? And how did you handle the expectation that you would find the answers right away from people around you that naturally were like, so how's it going? How's it going? How's it going? I mean, how have you been able to manage that expectation on people's part? And how long did it take you to get the work done, to be realistic about how much time it took you to find success?
Well, I can say that for the work that we've been doing in Kansas City, we're all about small wins. You know what I mean? Just to get something done quickly out of the gate, for people to see again that, the work that they've been doing is paying off even in some kind of small way. So we always look for those opportunities for the first small win. And then along with that, over the years, we've built in processes where by now we can get a project up and running probably twice as fast as we could about 10 years ago. And a lot of that has been built on the fact that we do have these relationships. We have a highly engaged community action board. It has about 30 to 40 people who attend and have been meeting now for over a decade. And so, and the table is open. We always say the more is better. I know some people like to work with a small group of people in planning and developing projects, but for us, the more voices at the table, the better. And it allows us to pivot more quickly, because those people who come to the table, whether they're running a small organization or they're just a member of a community-based organization or a church, they all have their own individual areas of influence and access. And so that really helps us to be able to speed up the process of developing and implementing projects with our community action board and with our broader Kansas City community. And so in having that board being established, they pretty much are junior researchers at this point in time. So they kind of know the process. And we've had a lot of those difficult conversations about ownership, you know what I mean, of the project and the money. The transparency came up. And I know this is a little bit off topic, but we really make sure that we push most of the money back out into the community. So ensuring that our faith-based organizations are paid for the work that they do. The church health liaisons are paid for the work that they do and the trainings that they go through. And I think even in doing that, it accelerates our ability to do the work because people know that their time and their input is valued. And so they're just that much more readily willing to jump in and help us to get the work done more efficiently as well.
That's fascinating, actually, isn't it? When someone says, I want to pick your brain, but I'm going to pay you for that time, that's a game changer, isn't it? But that's not always possible either. So I find it interesting that you say we try to push, most of that money back out into the community. I'll ask the same question of Dr. Alpert and Dr. Hurtado Mendoza. So how do you temper, that, are you done? How's it going? People's need to have things done quickly.
So I think it can be really challenging to navigate the demands of academia and the needs of community members. So I really appreciate what Dr. Berkley Patton said about small wins. I think that, for us, it probably took us a couple years before we had published a first paper together. And that was a win for us, just being able to put some of our ideas about things out into the world. And there was something that I wanted to mention. What was it? Yeah, and I think that really trying to value people's labor, both in terms of monetarily, but also in terms of making sure that people are authors and trying to, this is a little bit different than the question, but navigate that. I mean, in my experience, the community members I work with have views about the world that are more, that really push the envelope of what's accepted in academia. So trying to make sure that we're really making thoughtful decisions about the ways that we're writing our manuscripts and trying to stick by what we really believe rather than being willing to water it down for people who don't feel comfortable with what community members want to say.
I would also add, I think what has been challenging for me is that the timeline of research is very different from the timeline from the community organizations. And when you're starting something from the beginning, you might not have funds at the beginning. You might need to start doing some work without funds, or you might get a very small grant and you compensate the organizations, but the funds are small. And then this is a process of years, and little by little, you might get a larger grant and then larger, and then you're able to provide more compensation, but this could take several years. And I think it's important, the mutual understanding, about how the research world works, and also in terms of what it takes and how many months it takes to write a grant and then to get the reviews back. And then you do get some of those emails that have you heard back about the grant? Is it funded? Is it not? And I mean, and this is years. But I think I also like the small victories, and also thinking that it is a journey and not only the destination, but the journey. And I think this ownership and being able to develop these materials that we do together that we all feel proud about, and then just, seeing what we have able to accomplish together and develop. And I think that's what keeps us all motivated while we wait for the larger grants.
That leads me actually into, and someone asked it in the Q&A about, when you started the work, did you build on, and this may actually help with timeline too, did you build on work that had already been done, or did you start from scratch? Did you start right from the very beginning, was that the situation you were in, or were you starting something from the very beginning? Or were you building on something that had been set up before?
In our early work with the faith community, we started with probably one of the most difficult health issues that you could with the Black faith community, and that was around HIV and STIs. So as you can imagine, we had many conversations around, now, are you going to try to make us push condoms in church? Or are we going to have to start agreeing with premarital sex? And, you know, all of those controversial church-based topics. And so we just really had to make sure that the conversation kept happening and that people's comments and input were valued, and that ultimately the project looked and felt like what our faith leaders believed it needed to look and feel like. So our faith-based projects include our faith leaders, and as I mentioned earlier, in helping us to design what our intervention components will look like. They told us, first of all, you have to respect the church calendar. You can't just come in and start doing a program without understanding the church calendar. You can't come in and teach us how to preach. You know, you can give us some information that we can include, but you can't tell us, you know, how to do this. And so, you know, we just let them loose, and they pretty much designed it. And of course, then we came in and gave it structure. But starting again, it goes back to starting where they are, and making sure that the research was reflective of the feel, the vibe, the value of the church. And we didn't try to convert anyone to, you know, what public health strategies say you should do. They decided with our first initial HIV intervention that they would do testing, because they felt testing was a social justice issue, and they felt that there was a gap in the community around testing and knowledge and awareness around testing. And that's where they were willing to jump in. So that's where we jumped in with them.
So respecting that culture that already existed was key to getting and moving your agenda forward. Okay, all right. Dr. Alpert?
Yeah, so I think that one thing that's been really important for me in working with community members is being willing to have my ideas and what I want to do challenged at its core. So when I started, around the time that I started working with community members, I was working with someone at Wilmot who wanted to, or we wanted to start asking patients about their sexual orientation and gender identity, and we wanted that to be our project. So there's a way that people have kind of agreed in the United States to ask people about gender identity, in other words, whether they're transgender or not and what their gender is. And when I went to the community advisory board to talk to them about this project, they felt very uncomfortable with those questions. And we were kind of stuck for a little while about what to do, but we ended up deciding to do a project instead about how should we ask about gender identity. And so the community advisory board created their own questions, and we ended up writing a paper also about sex assigned at birth questions and their concerns about them. And that sort of took us in a whole nother direction, which was really interesting and neat to be a part of. But I think that if I hadn't been willing to abandon my idea about what I wanted to do and the way that I wanted to do it, I really wouldn't have been able to learn so deeply from the community members that I work with. So it was really a very transformative experience for me.
Yes, I would add. So when I started working with some organizations, there were other researchers before me who had started that relationship building. So it didn't take as long to build those relationships because you're building on years of trust and like other projects. But when I've had to start relationships from the beginning, I think it's important to be aware that it takes time and that it's really important to understand well the organization, like the people within the organization, their perspectives, their needs, and that each organization can be completely different in terms of their needs and their perspectives. And I think building on what Dr. Albert was mentioning, like being open to completely change what you had thought. And one of the examples that I have is that we were just developing a website for COVID-19 for African American and Latina breast cancer survivors. What we started developing, we completely had to change it because the community organizations had fantastic questions. They challenged the way that we were thinking about like some of the content that we thought that we would add, and it ended up being a completely different project that we envisioned, and it ended up being much better. So I think like this openness and transformative experience, as Dr. Albert was mentioning.
So you've had to be flexible in your approach to the research, and willing to say, maybe I don't have all the answers, right? Okay. Yeah, so that there's a vulnerability there. Again, that all boils down into, or goes back to the central relationship. And being vulnerable with people is such a huge part of any good relationship. It's just, you know, someone asked a question and I really like it. It was actually part of another question about what, again, we talk about our successes. We want to hear about the good stories, but you've also been very honest about your challenges. What would you say are some of the biggest challenges that you have faced to getting to where you are today? Maybe some of your biggest challenges. I mean, we've talked a little bit about money in some cases is a challenge, but clash of culture perhaps even is another, right? What are some of the biggest challenges to getting to where you are today, would you say?
Probably one of our biggest challenges is, what do you do when the grant funding ends? We know that for far too long, for communities of color in particular, researchers helicopter in, they do their grant, and then they helicopter out. And even if there was some benefit for the community, it just ends. Yeah. And so we're constantly working with our community partners to come up with creative ways to take that Cadillac, multi-million-dollar grant down to a Pinto that can still run the distance. You know what I mean? That still over time can have impact. Maybe it doesn't have all the bells and whistles as the initial grant, but still can have impact in a way that's sustainable and impact in a way that still engages our community partners, even when there aren't resources, financial resources to share. And so what we've done over time is to figure out again, working with our communities and our community action board, what's most important to them from the research studies that we've shared the data, we've done, meaning making with our action boards around the data. What do you feel are some of the most beneficial components of this intervention that we can sustain? And combining that with what our data shows us was, most effective about the intervention. And then we try to creatively come up with ways to do that. Everything from using students, from our health professional schools as health coaches, to training some of our long-term community health liaisons to take on new roles. And interestingly enough, even in those times when we haven't had funds to share with the community, because of our past commitments, they're willing to, take on continuing the work and embedding it into their infrastructure in such a way that it can be sustained.
So almost having developing influencers, right? So those influencers I think, I'm thinking social media, right? Like those influencers who go out and continue the work, right? They're your ambassadors to help you sustain the work when the funding is gone and they're in the Pinto, and they got the foot on the gas. Yeah. Okay. Dr. Albert, same question to you.
Yeah, I guess even before I answer the question, just want to express gratitude to other people on the panel at different stages in their careers than I am. It's just really helpful to hear about your solutions to problems I know I'm about to face. So just really appreciate your thoughts. So I think for us, that the biggest challenge that we've faced is, to be honest, working with collaborators who have a different worldview than the community members that I work with. And that's come up in particular in regard to manuscripts. So I was working on a project with someone analyzing some data from providers about their views about working with LGBT people. And me and the other person who did the data analysis, along with the community advisory board members, felt that the comments from the participants were very stigmatizing. And so when we wrote that up in the manuscript, some of our collaborators didn't feel comfortable with those findings and wanted to change them. And so we had to make a really difficult decision about whether to go through with the project and the manuscript or not. And so that was really challenging because we had to decide whether to report any findings or no findings. And we ended up deciding that we didn't feel comfortable going along with the manuscript without reporting out the actual findings. But that was very, very challenging to like my relationships with my collaborators and just trying to think through like how to do work with integrity, basically.
So I think like some of a couple of challenges that I have had have been, one, again, is in terms of the timeline, in that we develop education materials that can be important for the community. And then from the research side, the timeline is that you need to have first a pilot, then a randomized controlled trial, and then if it works, then you might have a implementation science grant, and this could take 10 years. But the communities have the needs and they want to use what we have developed right away. And then they would email me and say, like, can we please use this now, like in the practice, in the community? And I feel torn because it's a balance. Like as a researcher, I know that I shouldn't, because we have to prove first that it works before disseminating it. You're worried also about contamination if you're testing something right away. So that's if I put my researcher hat, but then if you put the community hat, like they need things right away. And then at the same time, it's like, okay, maybe when it's ready after we've been through all the pipeline from research, then we might need to redo it because the science has advanced so much that we need to start from the beginning. So that has been one of my biggest challenges, and I'm trying to think about ways in which to do the science that can make things faster so that we can think from the beginning about how things will be disseminated rather than wait so long. I think that's one of the biggest ones. The other one has been when they call you, and this I think was one of my biggest success, like when they call you and tell you, I have an idea, I want you to listen to it and see what your thoughts are, and I want you to be with us. And that is the most beautiful thing. But sometimes what their ideas, you might not have the expertise. So you want to help, but you might just not have the expertise, and just thinking about how to deal with that, and like maybe bringing other people to the table, but being responsive at the same time.
Doctor, I'm listening to what you're saying about your timeline versus the community's timeline, and we got a question about this very issue, and so it's very timely that you bring this up. But the question is about building relationships and reaching consensus with the community. Taking time, academic timeline is not synchronized with community timeline, according to this person who's asking a question, Aida Castro. The follow-up question is, how do you deal with this how do you deal with these different timelines, right? How do you balance the relationship you have with the academic demand of submitting grants and publications? So thank you for that question, Aida. And so I'll ask that of the other panelists as well. And we'll start from the very beginning again. So how do you do that? Like, and to the doctora's point about, we're sometimes not at the same place at the same time.
Well, for the work that we do, I mean, that happens often where the community says, we want to do a survey on, you know, this, and this, and we want to do it next week. And we're like, okay, you know, if we're involved, we're going to have to go through a process. And so, particularly with our community action board, we've taken the time to really kind of talk about the research process. As far as, you know, everything from the development of surveys or interventions to, we've discussed our IRB process, you know what I mean, in great detail. We've talked about human subjects research in great detail. But still, with that said, we don't always operate on the timeline that's been requested, but we always amaze ourselves in being faster than probably traditionally the timeline would be. And well, in those situations, we challenge our community partners. If this is what you say is really important and this needs to be done now, then you've got to jump in knee deep with us to get this done. You know what I mean? And because a lot of times, and I'll say this, a lot of times in doing community engaged research, we're really trying to listen and be responsive to the community. But sometimes as researchers, we got to kind of hold our ground too, because there are some things that, you know, just has to be done, you know what I mean, to carry out the research in the best way possible. And so we challenge them, you know, if this is really important, jump in, come in knee deep, and let's get it done. And when that happens, I mean, time and time again, we beat some of those, you know, timelines that could have been a challenge. But as we know, most times in community, the work takes a bit longer because we're really trying to be mindful of ensuring that the work is reflective of what the community says wants to be done. And in doing that, I mean, we've just gotten to the point where the publications will come, but they'll come in their own timeline. And I'm in a different place now than I was, you know, 15 years ago when, you know, I was on the tenure track and trying to get publications in and grants written and those kinds of things. But even then, in talking to, you know, my chair, it's like community work takes time. And so it's not like some of my other colleagues who can develop a survey on their own, go out and recruit, you know what I mean, maybe 110 people or less to do the survey and then publish 10 articles on it. I mean, we're doing work with thousands of people at a time, and you don't do that without having that timeline that's needed to really be collaborative in developing the work and collaborative in administering whatever kinds of assessments are going to be done, and being collaborative in writing the papers. Because when we first started this work, you know, our community members are like, you're going to have us help write a manuscript? I don't even want to write an email. You know? And so, you know, we had to tiptoe into that with them, like, we want you on this manuscript, you know what I mean? And sometimes we have to kind of drag them kicking and screaming, like, write this paragraph. Or write some, you know, give us the bullet points around what you made, you know, what your insights are about this project. And that takes time, you know what I mean? And, you know, again, I'm at a position now where I don't have to be as concerned about the timeline with my institution, but I'm always concerned about the timeline with our community partners. When COVID hit, we jumped in together, knee deep together, and the work that we did without any money really then set us up so that when the grant opportunities came along, we were ready, you know what I mean? We were ready to jump in, write the grants, conceptualize the work. And when the grant got funded, we have one of those rapid acceleration of diagnostics with underserved population grants through NIH, which had a really incredibly rapid timeline as far as startup is concerned. But we've been able to do that because of all the formative work that we did before the first sentence was written on a grant. So, so all of that's important.
I find that interesting. You said you require people to, there needs to be buy-in from the community, right? So, okay. Dr. Alpert.
Yeah, I really relate to that story about asking people to like at least just write bullet points or do something. Yeah. So I think for me at the stage I am in my career, the issues are a little bit different. So a lot of times opportunities will arise, and I'll have a certain amount of time to give input or not input, and make decisions. So I can find myself getting really worried about timelines and wanting like us to come to an agreement. But usually what I end up doing is kind of try to back up and figure out like what are the options on the table. So, you know, like if it's whatever time, we have like 2 minutes left in our CAB meeting and we have to make a decision and we can't seem to make it, then it's like, okay, well, we can meet again on this day and do this or this. We can tell this person, we can get back to them at this time, and just trying to think about like what all the options are so that we're choosing between like what's realistic. So that's how I've handled that issue around time.
Yeah, can I also relate to everything that was said? I'm thinking about especially, for example, IRB. So at the beginning, the community members might suggest some changes, but then you have to go through the whole process. IRB, subcontracts take months. So I think like there's a lot of bureaucratic aspects and like ethical aspects that take a long time that we have to consider. Also, community members doing the certificates for the IRB, and I think like sometimes the community organizations might not be aware and might not have a familiarity with that process. So I think that's something that we need to consider. And in terms of the timeline that I was mentioning before about the need to use some of our materials now versus waiting, I think one of the options we have done is to try to be creative and thinking about like there might be some things that we really cannot release now because we're in the middle of testing. However, like some of the things we have developed, I think, you know, like talking with them about like, okay, so maybe we can release part of the things that we have developed, or if we cannot release now exactly what we have done, maybe together we can build something that can fit that need in the meantime.
We got a question that came in, and I love this one because this is like, you know, this question gets asked a lot about so many things, but when it comes to the work that you're doing, how are you trying to reach out to millennials and so millennials and what was the other phrase they used? Because I'm forgetting, I know I'm Gen X, I think. Yeah, just engaging with young people and millennials, you know, how have you tried? Are they on your radar? You know, what are some of the ways you've tried to reach out to them?
Yes, we have in our work. We started working with youth around mental health issues with the grant that was funded through the Robert Wood Johnson Foundation. And we formed a youth community action board where they were involved in helping us we were focused on resilience, which was the topic that they said, the health related issue that they said they wanted to focus on because of the community violence that they were experiencing. And so resilience became a really big thing for our youth. And so they helped us to develop focus group guides, and we conducted focus groups. We formed an action board to take a look at those findings. Our action board helped us to develop a youth and adult resilience needs assessment that we conducted throughout the Kansas City urban metro area, and then use those findings to develop a pilot project to address one of the biggest issues that resulted from the needs assessment was found to be mental health, and finding safe spaces for youth to express themselves. And so we started that work right before the pandemic hit, and still were able to carry out our small pilot from that. And from that, once the pandemic hit, we've been able to tap those youth organizations to now focus on COVID-19 vaccinations. And so we've engaged our youth in developing the materials for them to be able to talk to their peers and family members about COVID-19. And we are doing trainings with them now to equip them with the tools that, you know, another smaller group helped to develop to be able to hold COVID-19 vaccination events specifically for youth with the youth organizations that are involved.
Yeah, so all the members of the community advisory board I work with are actually in their 20s and 30s. So I've had to learn a lot about like Instagram, Twitter, Facebook, all this stuff. And I mean, luckily they're just good at it. So they tell the rest of us what to do, and that works out pretty well.
Yeah, so I don't work with millennials, so my population has been oftentimes breast cancer survivors, so it's an older population, so I don't have that experience, but I would say that for all the work that we do, I think that doing formative research is really important, and trying to understand what are the needs of the audience, so then you can target better the research and the education materials or anything that you develop. So, but I don't have the experience specifically with millennials.
Mm-hmm. Edgar asks, I'm wondering if you've reached out to community members who have worked with researchers, et cetera, in the past to get their perspective on how to engage. This webinar is very important, but it is only one side of what we're trying to do.
Yes, absolutely. As a matter of fact, some of our early community leaders that began with us, you know, when we were just kind of testing out some of our processes in engaging the community, are now on pretty much every kind of research board you can think of. And I'm always amazed, even on some of these like national webinars, I'm like, hey, that's Broderick. He's from Kansas City, and NIH has tapped him now to, you know, talk about community engagement. So we're really proud of the fact that our community leaders are not only really steeped in research, but really serve an important role in getting some of their peers involved in research as well. And this has not only been in the faith community, but in some of the other community sectors that we've worked in. As a researcher from the community that, born and raised in the community that I'm working in, you know, I can go out and all day long and try to shake the bushes, but there's nothing like their community peers talking with them about research and talking with them about the importance of research. And now what's really cool is when our community organizations come to us and say, hey, we need some data on, you know, fill in the blank, or we're writing this grant and we need some of that data to put in our, you know, section on what the issues are. And I mean, there's nothing better, you know what I mean, than that. And they really believe that the research allows them to pivot and focus on what's most important for, you know, the communities that they serve.
Yeah, so two of the people on the community advisory board I work with actually started their own organization to try to provide support, like peer support to transgender people with cancer. So they actually get a lot of media requests from, you know, journals, newspapers, and other research requests as well. So it's been very interesting to hear and try to support them in making decisions about what they do and what they don't do and why. So like they were asked to be interviewed for a journal that was doing an article about transgender people and cancer, and they looked through the journal to see what else had been written about gender and just didn't feel comfortable providing information to that journal because they were concerned about how the article would be written. And then they were asked to participate on a community advisory board. But then when they showed up to the meetings, there was a corporate sponsor and they were concerned about the corporate sponsor's role in decision making. And when they had concerns about aspects of the research, the people who are running the board argued with them and didn't seem to be open to their viewpoint. So they ended up leaving that community advisory board. So it was Yeah, it was really instructive to hear about those experiences and just try to think about how to continue to build relationships that are supportive of them. So that was really helpful.
I would like to share an example of our main community partners, which is Nueva Vida, and we have had a long-standing relationship with them. Before I started working with them, there was 2 researchers working, and it's been like 15 years of relationship. And they developed, they wrote a manuscript to tell the story and the experience and their experience working with academic organizations. And the manuscript is about tips on how to establish community academic relationships. So I think that is very powerful because they can also inspire and be a role model for other community organizations as well.
So we have about 4 minutes left, and I wanted to be able to give the panelists time to perhaps share their best advice with everyone who was here today on doing this work and community engagement in general. What would be your best suggestion, your best tip, if you could?
I would say, especially if you're early in this work, to jump in with your community partners. I was sharing earlier with some folks here that when I first started working in the world of HIV with faith-based partners, they were already trying to address HIV. And I just showed up and said, tell me where you need me. You know what I mean? And you know what I did first? I stood at an event and I passed out brochures. I went to another event and I set up tables and just really kind of embedded myself into the organization so that they could see that for me, it wasn't just about the research. It was about, I'm concerned about this issue just as you are, and I want to be a part of making change just like you do. And then we can talk about the research and see if there's interest there. But just jumping in, and even with the work that we do today, you know, for my team, you've got to be willing to go sit in some church services. You know, you're not going to go and do a survey if you're not going to sit there and be a part of the service. So I just believe in that, that truly sincere being there for the right reasons and being committed to what their goals and vision may be for their organization.
Yeah, I'd say be authentic, and then I think be prepared for the way that you see the world to totally shift. I think that like every time so last night we were looking at an Ames page, and they had a lot of critiques of the way that I had written one sentence. Like we spent a lot of time on one sentence, and I had to remind myself, like, this is the gift. This is the most beautiful part of these relationships, is having the opportunity for the way I see the world to change because of the people I work with. And I think being able to approach those conflicts in that way has really allowed me to differently appreciate the work.
And I would also say that build the partnerships since the beginning. So from the moment you might think about a project, an idea, building those partnerships so that you can make sure that the community partners are with you throughout all the process, and that you collaborate since thinking about the idea, what are the needs, what is the design, making sure that you give back the results, and then just learning. I think I've learned much more from them than they have learned from me, and recognizing that their expertise is key.
We appreciate all of your time. Thank you so very much for sharing your thoughts and your expertise with us. Who's ready to get into the Pinto with Jeanette? Who's ready to? I'm in the Pinto because I have, you know, again, it's all about that trust. And I trust that if Jeanette hands me a Pinto, it's going to go. It's going to go. It's going to continue the work down the road. Thank you so very much to everyone. You were all wonderful. And again, I want to hand this back over to the fine folks who led us off. And thank you for having me here today. I've learned a whole lot from all of you, and I appreciate it.
Thank you very much, everyone. And I will make sure that everyone who registered today will receive a link to this video in order to make sure that everyone gets to see the entirety of this and really learn from our conversations. We hope to see the majority of you tomorrow at our second annual CCAC retreat. But for everyone else, thank you and enjoy the rest of your week.